Hello and welcome to the overview for the chapter on inflammation and immunology. So you've probably heard about human defenses, and there's lots and lots of different terminology that's used to apply or that's used to describe the human defenses. I'm going to make sure that we're all on the same page, but I do recognize that you probably heard this called different things. So basically there are three lines of defense. The first line of defense are the physical barriers, the skin, the mucous membrane. These are epithelial surfaces. The epithelial cells are right up against each other. There's not really space between them. And they form a really good barrier. But as you know, these barriers can be breached. And so we have two other lines of defense that we can use. The second line of defense in our class is going to be referred to as inflammation or the inflammatory process. And this is a pretty general reaction, and I'll tell you more about it throughout this overview and all the way through class. And then our third line of defense is sometimes referred to as immunity or adaptive immunity. You may have heard it called acquired immunity. It all means the same thing, mostly talking about the activity of lymphocytes. And then there are some umbrella terms that you'll sometimes hear. One is innate defenses. That means born with. So, we are born with our skin and our mucous membranes, and we're also born with these kind of general inflammatory cells that will help us fight off infections. The thing that kind of has to ramp up and responds to very specific infections is sometimes called the adaptive defenses, or sometimes called the acquired defenses. I'm going to plug in a microphone that may make it easier to hear this. We'll keep going. All right, so inflammation, we'll call the second line of defense inflammation, and the third line of defense immunity. So inflammation we're going to talk about these three components. There's inflammatory cells, and I'll tell you where they came from. There are some inflammatory chemicals that are released by those cells, and we'll talk about how different cells of the body respond to those signals. And then there's a third category, and these are plasma proteins. And you've heard of some of these. There's things like the complement system, but there's also the clotting system and a kinin system that you may or may not have heard of before. We'll go over that in detail in class. And then over on the adaptive defenses side, mostly what we're talking about are cells. And the cells over here are the lymphocytes. We'll talk about classes of lymphocytes called B cells that go on to produce antibodies, and we'll discuss those in detail, and then T cells and the different categories of T cells. For this overview, I'd like to focus in on the cells of both sides and where they came from. This diagram, the one with the little blue boxes, you're going to see that a bunch of times because I'm going to keep bringing that up. And then point out where we are in this big area, because there's a lot of parts to it and they interact with each other. And so there's a lot of I need to explain this first, and then we're going to go back to that. So here we are, we're going to see where the cells came from. This is a diagram that Dr. Doig has used in the past. It's quite a nice diagram. This covers hematopoiesis, hemato, blood, and poiesis, formation of or origin of, so blood forming tissues. As you know from your anatomy and physiology life, these tissues occur in the bone marrow. These cells occur in the bone marrow. There are some pluripotent stem cells. That is, they can become any kind of blood cell. And they'll differentiate into either a myeloid stem cell or a lymphoid stem cell. What I want you to notice is over on the left, most of the cells of inflammation come from this myeloid line. And over on the right, all of the cells of immunity
come from the lymphoid line. Now there's going to be a bunch of stuff here in the middle that we're not going to worry about for our class right now. We may talk some more about it when we get to talking about blood and blood tissue, but the mature cells that we're interested in for inflammation and immunity are going to be at the bottom of this diagram. So don't panic about this stuff, just keep your eyes down here. These are all the white blood cells that you've learned about before, the eosinophils, the monocytes that mature into macrophages, neutrophils. Platelets aren't exactly cells, they're cell fragments, but you've probably learned about them before. Erythrocytes, of course, are the red blood cells, and basophils. And so except for the platelets and the erythrocytes, the other things we would call white blood cells, and those are the cells of inflammation. On another diagram, I'm going to show you one more cell that's not shown here. And then over on the immunity side, these are the lymphocytes that mature and do different jobs. Now, I like this diagram, but you guys don't have access to this diagram in your textbook. So I'm also going to show you the version of this that's from our textbook. And it takes all of this information and shifts it over to the side. And so this pluripotent stem cell is going to be over here on the left. And then all the mature cells are going to be over here on the right. And so this one is figure 22.9 from our textbook. There's the hematopoietic stem cell, the myeloid line, and the lymphoid line. And as you'll see, the cells that come from the myeloid line give rise to the cells of inflammation. And the cells from the lymphoid line give rise to all of the cells of immunity. All right, so here they are. As we've seen, oops, wrong direction. All right, so as we've seen, there are the white blood cells, the monocytes. When the monocytes leave circulation and they go out into the tissues, they do a little bit more maturing and changing, and they develop into what we call macrophages, which if you take the macro means big and phage means eating. So macrophages are the big eaters. They're big phagocytic cells. They can gobble up a lot of stuff. Then we have neutrophils. These are also phagocytic cells. You may remember them as the white blood cell that specializes on bacteria. We have eosinophils and basophils. And then this is the cell that I wanted to point out. It doesn't show up on that other diagram that I showed you. The mast cells, these are hugely important in inflammation. They kind of get the inflammatory process going. These cells are already stationed out in the tissues. That's where we encounter them. We don't typically detect them in the bloodstream, but they originate from this myeloid line. So they originate in the bone marrow, and then they find their way to the tissues, and there they get stationed there. And then those are the ones that give rise to platelets, and then the red blood cells. Okay, now let's take a look up here. The lymphoid line, we've got the B lymphocytes or B cells. When they're stimulated by an antigen that we'll talk about, they can mature into plasma cells that give rise to the antibodies. More about that later. And then the T lymphocytes or the T cells. These are the ones that mature in the thymus gland and do certain jobs. I'm going to hint at something. Some of you may have picked up on this already. I said most of the cells of inflammation come from the myeloid line. So here's the thing. You've probably heard of natural killer cells or NK cells. They're lymphocytes, but they're kind of generalist lymphocytes, unlike the B cells and the T cells that are they go after something very, very specific. NK cells are more general than that. And so they've started being classified as cell of inflammation. And so that's the exception. There are some lymphoid cells that can actually do some general work here. But for the most part, the cells of inflammation come from myeloid and cells of immunity come from lymphoid. All right, let's take a look at, again, general overview of inflammation. We're zeroing in on this part. Remember, these are the cells, the the ones from the myeloid line. Let's talk about what it's for. It's for getting rid of things that are hurting us. Our physical barriers may be breached, and so we have bacteria or fungi or something that comes after us, and so we're trying to get rid of those organisms. There are some bacteria that are beneficial, for example, some of the ones that are in our gut, and we're not talking about getting rid of those. We're talking about getting rid of the ones that are doing us harm. There is part of this process is for walling off the site of an infection. I mean, clearly, if a blood vessel is broken, we're going to do the clotting cascade and make a clot and close that off. But also out in the tissues, something called fibrin, it's part of the coagulation system. You get some of those proteins from the bloodstream actually leak out into the tissues and kind of sprinkle around a kind of corral. And the advantage of having this kind of walled off area is, one, you limit how far the infectious organisms can get in the tissues, and two, you kind of corral your white blood cells that are also coming to the area and try to keep them concentrated where the infection is. This is a super important point. We talk about inflammation and we talk about immunity. And for a long time, we talked about them like they were two completely separate things. Now we've come to understand that there's an enormous amount of overlap between these systems. They interact with each other all the time. So a very important part of what macrophages do, for example, they do gobble up bacteria, and do, take in other invaders, but then they go on and present that stuff to the T lymphocytes, the T cells. And so the T lymphocytes can find out what is it exactly that we're going after. Part of inflammation, it sounds like a terrible thing, the things get swollen and they hurt, but it also stimulates the process of tissue healing. And some of the characteristics of the general inflammatory process. It occurs in vascular tissues. So we talked about how the cells that are involved here all came from the bone marrow. So they can only get delivered to the tissues that have good blood supply. And that's, of course, most of our tissues. But there are some connective tissues, for example, that aren't very well vascularized. Some connective tissues are, like the dermis of the skin, that's the layer under the epidermis, fantastic vasculature, great blood supply, heals really, really well when it's damaged. But there are other connective tissues, like the dense connective tissues that make up ligaments, for example, because the collagen has to be all lined up a certain way. And if you had blood vessels going through there, it would mess up the lining up of those proteins. So ligaments do not have great vasculature. They're also famous for not healing very well. Cartilage is another one. Again, there's blood supply kind of around the cartilage, and that stuff, the stuff that cartilage needs diffuses into the tissue, but there's no blood vessel going through the cartilage. And again, cartilage does not have great vasculature, does not have great healing. So inflammation occurs best in well-vascularized tissues. The response is immediate, that is within, the cells are stationed there. We talked about how mast cells are in the tissues, and so are the macrophages. They're already in place. You're going to get a response within minutes, and definitely within the first 24 hours. The response is non-specific. This is in contrast to what we're going to see over with the lymphocytes that are so specific for a particular shape. This kind of response is, oh, it's a bacterium. This is how we respond to bacteria in general. There's no memory. That means that the first infection with the bacterium is the same. You're just going to get the same kind of response the 100th time you're exposed to that same bacterium. And again, this is in contrast to what we're going to see in the immunity side. Now, inflammation, it's going to affect anything in the vicinity. So yeah, you've got an infection, you're going to get rid of those infectious agents. You actually may be damaging some healthy tissue, some cells that are supposed to be there, and they're actually going to kind of get stuck, get caught in the crossfire. And so we actually do have mechanisms for limiting the inflammatory response, because if it went on unchecked, it could damage healthy tissue. All right, the components that we'll talk about in class, there are three main areas. I've listed them on that diagram that has all the blue boxes. There are the cells, and we've already talked about where those came from, those lymphoid line, or sorry, myeloid line cells, the inflammatory chemicals that are released by those cells. Here's the diagram I'm going to use to talk about this in more detail. In class, it's figure 6.4 from our text. And finally, the plasma protein systems. And there are three of those, and they're covered in this diagram on figure 6.3. And so we'll refer to the complement, clotting, and kinin systems during class. That brings us to the end of inflammation for this overview, and we're going to move over to the general overview of immunity, and that's this side, the adaptive defenses. Remember, the cells of immunity, they come from the lymphoid line. So what it's for, it's to, like the inflammatory response, it's to prevent and eradicate infections, get rid of infectious agents. What's less well known, but quite important in its functioning, is it's also involved in the surveillance for and destruction of cancer cells. So our T lymphocytes, our T cells, are cruising around our tissues all the time, and our normal everyday tissues are forever showing bits of themselves out on their surfaces. It's kind of like showing your ID and saying, yeah, I'm supposed to be here. And so sometimes when cells, mistakes happen, you're copying the DNA and things go wrong, and cells start having they're not behaving right, they're not displaying the right kind of proteins. The T cells tap into that, and in some cases will destroy the cancer cell themselves, or they can also kind of press a button, if you will, and stimulate our own cells to undergo apoptosis. Remember that programmed cell death? It's basically saying, yeah, you're right, something's wrong with you, and we don't need you to keep making things go bad here, so go ahead and get rid of yourself. It's an amazing system. Now, you may be thinking, this system can't work because people get cancer. And it's true, people do get cancer. Some of the cells do escape detection, and then they mutate and they elude the system of detection. But there are many more cancer cells that start developing and then are killed off by our immune system than we ever detect as a pile of cells, which is what a tumor is. So they're usually caught before it gets to the tumor stage. All right, the immune system is also the part of us that responds to tissue grafts. We've gotten really good at transplanting tissues, taking tissues from one donor, somebody who has working kidneys, for example, and to somebody who doesn't have working kidneys. And it's fantastic that we can do that. We know that we need to match donor and recipient. A few things, make sure they have the same blood type, make sure that they have the same kind of MHC proteins. We'll talk about that during class. But they're not always perfect matches. And so it's this part of our defenses, the immune system, that can get sensitive and start rejecting an organ, if you've ever heard that phrase. So when somebody receives an organ transplant, those people are put on immunosuppressant medications for the rest of their lives. And yes, they are at risk of developing infections more than if they weren't taking immunosuppressants, but they're taking the immunosuppressants in the interest of preserving the transplanted organ to keep it from being rejected. Some of the things that can go wrong with the immune system, you've heard of them before. It can cause cell injury. It can stimulate. Oh, remember we talked about how the inflammatory side of things can stimulate the immune side of things. Well, it can go the other way, and unfortunately, it can go wrong sometimes, and you get a pathologic inflammation. What we call allergies are also due to the activity of the immune system. It's not a good activity. It's an overreaction to something. We call these hypersensitivity reactions. Sometimes it can be something like, as innocuous as pollen. In the spring, there's lots and lots of plants producing pollen, and that gets into our respiratory system, for example. And, some of us it starts getting hard to breathe, and there's runny nose and the watery eyes. That's not great, but it is a result of a misfiring of the immune system. In some cases, it's not just inconvenient, it actually can be life-threatening. You've heard of the way some people respond to peanuts, for example, or strawberries, or shellfish. There can be these insanely over-the-top reactions of the immune system. It's a completely innocuous stimulus, but the immune system's reaction can be deadly. And then the final problem I'll mention in this overview is the immune system can start to attack its own tissues. This is what we call an autoimmune disease. We don't fully understand what triggers autoimmune diseases, why they occur. We know very well, we have lots of empirical evidence that they occur. There does seem to be a genetic component to it, and I say that because the tendency to develop an autoimmune disease can run in families, but we have yet to identify what the genes are that are responsible for that. And what gets inherited is not the particular autoimmune disease, it's the propensity to develop an autoimmune disease. So in a family, one person may have type 1 diabetes, and there may be another person with type 1, but there also may be somebody who has lupus. There also may be somebody who has rheumatoid arthritis or multiple sclerosis. These are all autoimmune disorders. And we'll talk a little bit in class about some hypotheses about why those occur. And now to wrap up this overview, we're going to compare the inflammatory response with the immune response. And I'm going to take this third line, we're going to move it down. And the comparison I'll make, this information about inflammation is going to be over in the top left, and the information about immunity is going to be over on the bottom right. So summary of the inflammatory response, it's rapid, within minutes, a few hours. Non-specific, you're responding as a class to bacteria, not a particular bacterium and this particular protein on that bacterium. There's no memory. First reaction is the same as the 100th reaction, or exposure. And we've said it involves cells and the plasma protein systems. Let's compare that with the immune response. It's much slower. And I should say, the measurable response is slower. Things will start happening right away, but they're completely undetectable to us until 5, 7, 10 days later, when we can start picking up like antibody levels. And it's because this reaction is so specific. There are only a few cells that are going to react with this particular protein shape. And those cells need some time to proliferate, to make copies of themselves, and to get a population that's big enough that you can start to detect things. Going back, that's why it's so slow, because it's so specific, and there are only a few cells that are going to respond, and those have to make copies of themselves. The fantastic thing about the immune response is that there's memory, if you will. What that means is the first time that you're exposed to something, it's going to take many, many, many days to ramp up a reaction. The second, the third, the fourth time, the reaction is going to be much faster because we already have some memory cells in place that can be called on to make copies of themselves quickly and can start producing, say, antibodies against the infection. And as I mentioned many times, it's the lymphocytes that are responsible for the immune response and the antibodies produced by some of those lymphocytes. And then finally, going back to this memory issue, we have figured out how to make that memory system work for us. And the process we use is known as vaccination. And we'll talk about vaccination in some detail in class. So when we start class, we will have some general questions about this overview. And so we'll start right away with some iClicker questions at the very beginning of class. See you then.